we will look at birth injury malpractice involving perinatal hypoxic ischemic encephalopathy, or HIE. HIE is one of the most serious types of birth injuries that can result from medical malpractice during labor and delivery. HIE occurs when both oxygen and blood supply to a baby's brain is interrupted or severely restricted during childbirth. The deprivation of oxygen and blood causes cells in the baby's developing brain and other vital organs to rapidly decay and then die. HIE can be a devastating birth injury with tragic consequences. A quarter of all newborns diagnosed with HIE will die in the first week. And for those that survive, 30% will suffer permanent brain damage to various degrees of severity. Brain injuries from HIE often result in physical disabilities and cognitive impairment. Unfortunately, the damage to the brain from HIE is permanent and cannot simply be fixed with surgery or medications. Treatment options involve therapy and medication to help manage the effects of any brain damage. Babies with severe HIE injuries will often need lifelong support and accommodations. HIE is triggered by an interruption of blood and oxygen flow to the baby. This interruption can be caused by several conditions or obstetric complications that arise during pregnancy or childbirth. Complications associated with HIE include uterine rupture, umbilical cord problems, placental abruption, and others. HIE is often the result of medical negligence, usually because the obstetrician or nurses fail to take the appropriate action when confronted with a difficult childbirth. When complications arise during labor and delivery, doctors have a limited time to respond. This often leads to medical mistakes. HIE can also result when the doctors and hospital staff fail to properly monitor the mother and baby during labor. HIE is frequently prevented when the delivery team does as they're trained and diligently monitors the baby and promptly intervenes with an emergency C-section at the first sign of fetal distress. But when doctors and nurses make mistakes and fail to address the baby's cries for help via the electronic fetal monitor, the consequence can be life-altering for the child, including cerebral palsy and permanent physical and cognitive injuries. When a child is born with HIE because of medical negligence or error, the parents of that child have every right to seek financial compensation for the injury. If your child suffered HIE as the result of medical malpractice, call our birth injury lawyers today at 800-553-8082.